Hi, I want to welcome you back to Functional Medicine or Mountain Health Functional Medicine. What I'd like to do in this video is briefly go over what the heck is functional medicine, because a lot of people don't know. And basically, functional medicine kind of got its beginnings back in the 1990s and has been progressing over the past 20 to 30 years. It's very much based on science. We have a lot of scientific evidence to back us up. But basically what it is we go back to the root cause of your problem and address that root cause, whereas traditional medicine will focus on the symptoms, give a medicine to lower, to lessen the symptoms, but they don't treat the root cause. And when you miss that root cause, what you end up having is disease progression. One of our sayings we really like to say a lot is our genes are the gun, but it's the environment that's the trigger. What I mean by this is we're all born with a set of genes that we inherit from our family before us. And some of these genes are good and some of them are bad. And some of the ones we know now that are bad are the BRCA genes, the BRCA1 and the BRCA2, which predispose women to increased breast cancer, increased ovarian cancer. There can be an increased colon cancer with these people. And a famous person we all know at this time is Angeline Jolie, who carries this abnormal gene, and to try to decrease her risk for cancer, she underwent bilateral mastectomies and had her ovaries taken out so that these organs do not become cancerous. And to a functional medicine practitioner, this is probably not the best thing to do because what happens, we are born with certain genes, and some of these genes are what's called suppressor genes, and what they do is they suppress the bad stuff. Some are promoting genes, and what they do is promote the bad stuff or the good stuff. And what we've learned nowadays through particularly the human genome experience is that many of the genes we have can be suppressed or expressed based upon what we eat, what supplements we take, what our lifestyle is like. So from a functional medicine standpoint, somebody who has a bad gene, say, promote cancer with those people, there's things we can do to keep the genes from being expressed. And there's things we can do to keep the good genes expressing to keep the bad ones suppressed. Make sense? And so, yeah, from a functional medicine point, having bilateral mastectomies and having the ovaries taken out does not make a lot of sense. In fact, my boss, or really the guy that was one of my gurus in oncology, which I did for 33 years, was Dr. Fry Reich, who's considered the father of chemotherapy, combination chemotherapy, particularly in childhood leukemia. And back in the 1980s, he was famous for saying in a mixed crowd, I know how to cure breast cancer, and it's very simple. And he would go and say, you know, we take all girl babies at day 3, kind of like we take the boy babies at day 3, and we take them to surgery and say, you know, we don't have to numb them up because they're too little to talk. They don't remember the bad experience. But with the boys, we'll do the circumcision, and with the girls, we'll do bilateral mastectomies. And we will cut down breast cancer. And he'd like to let people think about that for a while, and then he would say, you know, 2 problems with that approach. Number 1, slow dancing would never be fun in junior high. And number 2, we're not going to change the incidence of cancer at all. And come now 30, 35 years later, he's being proven true. In this country, last year, the number of double mastectomies has tripled, and the incidence of breast cancer has not changed any. So all these ladies are having these mastectomies, but they're still coming down with cancers. It hadn't changed anything. So the environment is the gun, but the genes are the gun, but it's the environment that's the trigger. And so what we do in functional medicine is we go back to the root cause and address the root cause. Again, 20th century medicine or corporate medicine being practiced today, or the medicine in the big palaces, what they're doing is treating the symptoms and lowering the symptoms. They're not treating the underlying illness at all. Remember I talked about the fellow with chest pain going to the hospital and he gets a stent put in the heart. That chest pain goes away, the angina goes away, but he still has heart disease. Whereas if you went back and addressed the root cause for heart disease, his heart disease can be resolved completely, and we have great evidence showing that this is possible and not hard to do. And another common example, particularly in adult medicine, is adult onset diabetes. Traditional medicine says, here, take this metformin, take this insulin, take this combination of drugs, and your sugars will come down. But I know with time, because you're not treating the underlying cause, that person who starts on one medicine will eventually go to 2, 3, and maybe 4 medicines if they live long enough. Whereas we know in conventional medicine, with diabetes, particularly in the adult, with type 2 diabetes, it's due to an insulin resistance. The body needs more insulin to get the sugar to go in the cell, and eventually all the insulin you're making doesn't do the job. We know if we change your lifestyle, very simple to do, change what you eat, get a little activity, some supplements to help get your hormones balanced, that insulin resistance is going to come down and you don't need all that medication. So if you treat the root cause, you have disease resolution. You treat the symptoms, you have symptom resolution. Which one would you rather have? We also know in functional medicine that the cause of illness is different with everybody. And what we mean by that is in functional medicine, we know one thing you do could cause multiple diseases. And some person, you do something abnormal or wrong, one guy is going to have heart disease, another guy is going to have arthritis. So one issue can cause multiple disease entities. We also know that multiple issues can cause one problem. And again, goes back to diabetes. There can be multiple causes of diabetes that make that insulin resistance high. And if you don't treat all of them, don't address all of them, you're not going to have any improvement. The other thing that functional medicine does is it's really using the best in the world of all medicines. Many of the functional medicine doctors are MDs and DOs, which means we can prescribe medications just like the 20th century doctor can. The 21st century functional medicine doc can prescribe those medicines when needed. And that's the thing, when needed, oftentimes they're not needed because there's other things we can do. We also bring in the best dietary nutrition practices in the world between all different disciplines, tying that together. Our 20th century doctors are not very good, are not very well trained in nutrition. The other thing is we bring in different disciplines from different type of practitioners. I use acupuncture. So I'm bringing in techniques that are 3, 4, 5,000 years old to help in 21st century medicine. The other thing we do is bring in 21st century medicine using such things as laser therapy or a low-level light therapy, and a lot of scientific evidence showing the benefit of doing that. The other thing we bring in is such things as massage therapy or Reiki therapy. Different practitioners will concentrate on one, but I myself will consult out to a massage therapist or a Reiki person to help with my patients, because I know whatever it takes to get them well, that's what we're going to do. We concentrate on physical activity or physical therapy, so we're incorporating physical therapists in our programs, we're incorporating health coaches in our program to show you how to get healthy. So it's using the best of all worlds, whereas the 20th century medicine, the corporate medicine concentrates on medications and surgery. We have those options, but we have a whole lot more things that we bring in. Next thing, what functional medicine is it's patient-centered, which means we have to find the root cause of that illness for this person, which is going to be different than this person, which is going to be different than this person over here. Whereas again, traditional medicine, you have diabetes, so all of y'all need this medicine here. Some of you are going to need these 2 medicines, some of you need these 3 medicines. We individualize it for that person, and to individualize that treatment, that plan, that healing progress, we got to know a lot about you. We got to know a whole lot of information, much more than the 20th century doctor does. One of the things we end up doing in functional medicine is looking at 5 areas with everybody. And one person we may concentrate on 3 of the areas, another person may be 2 of the areas, but all 5 areas of health we need to work on, different degrees, again, based upon that person's issues. One of the areas is detox, and this is not a Betty Ford detox in the hospital. It's not one of the old detoxes, or it's a colon cleanse and you got to stay close to the bathroom for weeks and you can't go to work. This is a much more scientific, a more gentler approach. It's basically a cellular detox, trying to get that liver, that colon functioning properly, And to do that, we concentrate on things that are going to improve the mitochondrial activity in the body or the ATP production. We got to do detox. We work on nutrition with people. In functional medicine, we have about 5 or 6 different diets that we use with people, depending on what's going on with them. We're not so much into calorie counting, but teaching that person how to eat right for the issues that are in front of them. And the goals are being, as they get more healthy and start functioning better, they go to a more broad, more general, more fun diet. But all of our diets basically, and we don't like that word diet, but it's a nutrition plan. All of our nutrition plans are easy to do. They taste good. You don't go hungry through all of this stuff. Third thing we do is looking at physical activity or motion. We know, you know, we all know exercise is important. People have to exercise to get well and to stay well. But it doesn't mean you have to go to the gym 1 hour a day, 5 days a week, 6 days a week, or 7 days a week. We can teach you how to exercise appropriately for your age and where you're at in life. Some of the exercise things we do is bringing in yoga or Tai Chi. We do weight resistance training, showing people how they can be in the gym maybe 30 minutes, 3 days a week to get fit and shape. The fourth thing we start working on is that nervous system, and that's so closely tied to health. In this country, we use antidepressants for depression. In Europe, they don't use those antidepressants. They're contraindicated. They use lifestyle changes and food changes and supplements, physical therapy, and you know what? They get better results on treating depression than we do in this country. 45% of all women over the age 40 in this country are on antidepressants. It's not that way in Europe, and the United States person is not any different than a European or South American. The fifth thing we work with is getting your hormones in balance. And things, what I mean is getting that thyroid checked appropriately. 20th century medicine, corporational medicine, the big clinics will focus on maybe a TSH and maybe a T4. When you come to a functional medicine doc, we're going to check those 2 things, but we're going to check your T3, and if needed, there's about 15 other lab tests we know that are important to make sure that thyroid's functioning well. Again, we go back to the root cause of that thyroid disorder. We don't just give a thyroid hormone, but we go back to try and get that thyroid functioning so that you don't need that thyroid hormone. Then we're checking things like cortisol, and we check it 4 times a day because cortisol is high in the morning and then it goes down during the day. And we got to know where you are throughout the whole day to know whether it's too high or too low. Traditional medicine won't do that because insurance won't let them check it 4 times a day in the home. They'll let you check it 1 time in the lab with a blood test, but not 4 times in the home. The other thing we look at is testosterone, estrogen, progesterone, and getting those things balanced. When out of balance, and getting them optimized using bioidentical hormones, which do not carry the side effect profile as the synthetics which used in this country, which is promoted by our pharmaceutical industry. But in Europe, when they're using bioidentical hormones, what they see is decreased heart disease as opposed to increase in this country, decreased Alzheimer's, decreased strokes, and decreased breast cancer and prostate cancer, whereas in this country, it's increase of all that stuff. So with everybody, we're using those 5 programs. And one person we may concentrate on 2, another 3, another 4, but all those 5 areas we're looking at with you. Functional medicine is very much goal-oriented. We want to find out what your goals are on getting well. How coachable are you? How much time is it going to take? It's going to be different on everybody, but we want to get you with your health independence. Again, I don't want to work with you and make you become dependent on me the rest of your life. I want to work through a program with you, educate you, show you how to do things, get those things incorporated in your life so you don't need me. You don't need another functional medicine doc. You don't need your private doctor except maybe every 2 or 3 years for a simple physical exam, and that's it. And that's doable. That's doable. So what we end up doing is educating people. We have time to educate you. We know how to educate you. We do that in our clinics. We do that online with a lot of video instructions, a lot of email, a lot of podcasts. We educate you according to the 21st century educating mechanisms. And then we mentor you, we become a coach, we become a friend. You come into our community, we come into your community, and we both mutually have to ask the other person. Just walking through the door, you don't qualify to come into my practice. I want to make sure that you're going to work, and I want to make sure my personality and yours mix together, because if we don't work together, we don't get good results. And if we don't get good results, my clinic doesn't get that reputation of helping people, and you get frustrated, and then nobody gets help. And then we want feedback from you. We listen to your ideas. We want to hear what you need. We want to hear what you think. We want to hear how you're responding. We want to hear what you think about what we're trying to do with you and make suggestions. We want to be in partnership with you. So basically, that's functional medicine, and it's not just Mountain Health functional medicine. That's what you're going to find with any functional medicine provider in this country, around the world. So thank you. Have a good day.